So what does that mean? Like 83%. So I think the research have shown that, or the studies have shown that, out of 83%, 60% of the people actually do not hear or notice the tinnitus anymore. And that's and one key component is a lot of times we get asked, so do I have to wear, do I have to listen to this speaker every night,
Right.
after my therapy or after the treatment is done? And the treatment is up to 24 months, right?
Yeah.
Okay.
Yeah.
So
usually starting around 4 months, depending on each case, right?
Yeah, and the statistics that you see the line, you get a significant or clinical improvement as soon as 3 months, right? So there's an improvement right away, and then the improvement slows down, but then it continues on to a point where, we hope that you become that 60% where you don't really hear your tinnitus anymore.
Yeah.
The other 24% do find it or do hear it, but it doesn't have any emotional attachments anymore. Because it doesn't have any emotional attachments, that vicious circle, that negative feedback has been severed. And that once that relationship is severed, we now are not really bothered by tinnitus.
Yeah.
Okay?
You actually have to sit and think about it.
Yeah.
I think I heard.
So.
And the other thing I would like to add about this treatment is that it's temporary in terms of having to follow the protocol, right? So if you're wearing, say, the sound generators or using this at bedtime, it's not something that you have to do for the rest of your life. And I think that's why it's so appealing to so many people. And the funny thing is, a lot of people do continue on to use this.
Yes.
And it's, it could be more of a comfort thing. I actually listen to this at bedtime now, since I was introduced to it at the training, and it's not a bad thing, but yeah.
Yeah. So and that's the most appealing, right? So if you're one of those patients that says, hey, I don't really have a hearing loss, or I don't have a hearing loss, I have normal hearing. You tested my hearing, I have normal hearing, but I have tinnitus, right? For whatever reason, cause again, right? Once we have taught your brain how to ride this bike, you will be able to ride any bikes. And so there's the research also shows that there's no relapses. There's very little or none relapses. So people oftentimes say, what if I hear another sound at some point in time?
Right.
Am I going to be going back to? Do I need to repeat the treatment? And the studies have shown that we don't have to do that. So that's how we believe is such an effective treatment. Okay.
Yeah.
So once the treatment is done, you can take off the on-ear devices, on your sound generators, and you don't have to use this, okay? And those are all optional at that moment. Some people who have hearing loss, though, they oftentimes continue to wear because they see the benefit of that sound therapy.
And the amplification.
The amplification, that they can hear better in noise, etc., like that, right?
Yeah.